Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill.
And I'm Sally Pace, and today we are joined by Christi Coleman, who is the Chief Customer Officer with ProactiveMD. Christi, let's start by just telling the audience a little bit about your role at ProactiveMD.
So I oversee sales and client service. I'm super passionate about building strategy with employers and helping them solve their healthcare issues and the partnerships that come along with that, right? I've been in the industry for over 30 years. I have deep partnerships. I like to call them friends, but it's all about transforming healthcare for them in their given populations.
Well, thank you, Christi, for joining us today. Looking forward to the conversation. What attracted you to ProactiveMD?
Yeah, it was really the opportunity to make a difference. When I met John Collier, our CEO, I saw and heard his commitment to changing healthcare and to building something different to support clients and patients individually. We know our clients each, as individual organizations, have different struggles, have different culture characteristics. And so the passion around getting to know them and building solutions that ultimately impact the health of their employees and their families and ultimately their healthcare costs.
Speaking of partners and friends, you guys have been partners and friends of us at the Granite List for a long time, but share with our audience the scope of work that ProactiveMD actually does.
We provide a strategic approach to a total health and population solution to employers through advanced primary care. We currently serve clients in 20 states and we serve multiple industries from manufacturers, schools, municipalities, food processors. We touch oil and gas. We have a few state entities. We really strive to find the employer that's looking to provide healthcare in a different way, impact their costs in a creative way to ultimately improve the health of their population.
Let's dig a little deeper. Advanced primary care. Can you give some more color around what that is and what you're offering to your clients?
Sure. So, advanced primary care focuses on high quality care and ultimately improved health outcomes rather than volume based clinic measurements. And so, from a volume based perspective, how many patients can I see in a day? We're looking at how much time can we spend with our patient. We empower our providers to care without compromise and practice medicine the way they're trained. So, again, they're spending time with the patients. We're keeping 80% of the services, primary care services within the health center. We pair our provider with a patient advocate, which is a social worker, because what we know about health centers is it's not a build it and they will come. We have to meet that patient where they are. If they are having financial issues, they're not going to address their diabetes. So, getting to know a population, immersing in that culture, and engaging the population in a proactive manner is at the forefront of what we do. Our patient advocates are also community resource experts. They become benefit experts for the employer. And in many cases, they offer behavioral health. The other component of advanced primary care, Sally, is care coordination. We identify high quality, low cost network providers in each of our local communities that we serve, and we hold the patient's hand through the entire process. Again, we want to make sure they're in network, but we also want to make sure that they're high quality, low cost, they've got appointment availability, and that patient is pulled back into primary care once the service is complete in the community.
Okay, you've just brought up several things that I know are a differentiator. You talked about social work, community resources, mental health support. Are there other ways that advanced primary care is different from traditional primary care?
Absolutely. So we integrate OC health services as well as physical therapy and in some cases even dental. So what are the services that meet the needs of the client's population that we can remove the cost from the community and pull into the health center to provide a broader approach to the healthcare that the employees and their families have access to?
So, tell me about employers. What is their driving motivation to partner with someone like ProactiveMD?
That's a great question. In many cases, it's retention, it's helping recruit, it's How can I provide a benefit to the population and improve the health of the population to improve productivity? The employer can make a difference in their population and lower their healthcare costs by making primary care the root of their healthcare strategy. We love working with employers to learn about the healthcare challenges that they have, that they may be facing, and then turning to data for the guidance around what services can we provide, what type of languages are we going to serve, and how do we accommodate their population to entice them to engage in the health center. Again, our goal is to immerse in that employer's culture, for our care teams to immerse in that employer's culture, and to work towards our collective common goals.
So, employers, I'm assuming there's cost savings or valued outcomes centered around an employer's incentive for partnering with ProactiveMD. You mentioned enticing the employees into the center. What motivates a plan member to come into a ProactiveMD facility?
Our patient promise, and we all can recite this, and many of our clients could probably recite it too. We are only and always about the patient, and we promise to fight for their greatest good. And when we allow our providers to spend time with our patients, we get to know them as individuals, not just a patient. And when we understand what they're going through, we can help them navigate whatever their particular circumstance is. We had a situation recently with one of our municipalities where a police officer had been in an accident and ended up in the hospital. Our patient advocate was on their Facebook page, saw the incident, met the family at the hospital, brought them Chick-fil-A, made sure that they got adequate care. And if they had any questions, she was there to answer that question. Met with the client the week after, and the client was like, "Hey, I wanted to tell you about this story." And the patient advocate was so proud, right? They had already been at the hospital, they had already met with the family, and that's at the root of what we do. And so, from a patient perspective, whether it's identifying particular disease states, even cancers, through our proactive health review, which is a preventive exam, or through, again, understanding what their situation is and holding their hand through the complex healthcare system that we all know exists today, we help patients understand how to navigate healthcare. We keep it simple for them, and we also help them get to their full capacity so that they can live fruitful lives.
Simplifying the navigation of healthcare is so important. It's such a confusing web. What trends have you noticed in the on-site healthcare market? What are you seeing? We talked to you a couple years ago and talked about the trends, but what are you seeing up until now? And then what do you see is going forward into the future?
That's a great question. Increased demand is one of the primary trends, and employers are becoming more enlightened. They work with their consultants, and they are seeing the importance of primary care and the importance of access to primary care. So, we are reaping the benefit of getting to meet many new clients across the country. Staffing challenges is another trend that we're seeing. We typically serve in rural communities. So, rural America is one of our strengths. And finding providers, finding support staff, we have to get creative. I like to say we don't use the Staples easy button. We are always looking for a different way to approach a challenge, and staffing is one of those. So, what are we doing from a recruiting perspective that's different and that can serve our customers well? Also, the increased services that we mentioned earlier. We're seeing a lot more interest around providing physical therapy on site, supplementing primary care on site with virtual specialty visits. In New Mexico, we're 6 to 9 months out with in person specialty visits. So we've created solutions around virtual specialty visits so that we can expedite those visits. Behavioral health is the topic that's not going away. And so, how are we addressing the mental health in the populations that we serve? And then OC health and work comp. That's becoming more and more requested as a key service alongside primary care, and ultimately looking at the full employee's health, not just primary care, but primary care, OC health, and injury management. And then virtual care. So, where a population is concentrated in one area, but they have remote employees, we're seeing a significant interest in virtual primary care as a supplement to the on site care that we can provide to the consolidated employee population. And then last, we're seeing an influx of private equity and consolidation, big players coming together. We pride ourselves on being privately held. Our founder and CEO, John Collier, is our primary owner, and that allows us to be flexible and nimble and work with our employers, as I mentioned earlier, on strategy and do we best serve them and impact their employees' lives. And again, continue to move the mark on what did we do today? How do we do it better tomorrow?
Can we close by kind of talking about what type of employer is a good fit for Proactive MD services, and then how they take the next step if they're interested in the concept of advanced primary care?
Sally, that's a great question. Most of our employers today are evaluating their healthcare costs. They want to do something that is impactful. We are looking at employers of 500 employees or more for the on site primary care service. And in multiple different industries, the industry doesn't necessarily drive the need and the impact. It's really the employer's appetite around having primary care as the center of their healthcare strategy and the appetite and budget to invest up front to see the return long term. And then as far as how to access Proactive MD, we have a info at proactive-md.com. And then our website is proactive-md.com. Thank you so much for the time today.
Absolutely. Well, thank you for joining us. Thank you for being a longtime friend of the Granite List. And thank you to our audience for listening to another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.